Hello.
Hello,
I'm Jonathan. I'm going to be your nurse practitioner today. Can you tell me your name and date of birth?
Brianna, October 1st, 1992.
Okay, great. What brings you in today?
I just came in because I'm having some throat pain.
Some throat pain? Okay. Tell me a little bit more about your throat pain. When did it start?
It started a couple days ago. Whenever I, I just clear my throat,
Mm-hmm.
it hurts a little. Try to keep warm and cold things to drink or eat,
Okay.
and it tends to help a little bit.
Okay. Good. Good. Are you taking any medications to help with that?
It's just teas,
Okay.
homemade
So
teas.
just to be clear, you started a couple of days ago. Um, is it constant or intermittent or does it come and go or is it constant? Okay, all right. Is it a stabbing pain or an ache, scratchy? How does it feel?
Tenderness, sore.
Little tenderness and soreness. Okay. Um, does anything make it worse?
Just clearing my throat.
Just clearing your throat. All right. Does it radiate anywhere?
Mm,
Okay. On a scale of 0 to 10, how would you rate your pain right now?
mm, 4-ish, 5.
Okay.
It's not bad.
And at its worst, how would you rate it?
7.
A 7. And is that when you start taking your teas? Okay. You don't take Tylenol, ibuprofen, or anything
No
like that to help it.
medicine.
Okay. All right. Cool. So I'm gonna just do a little interview. We're gonna go over your history, your medical history, your family history, and some other things. So I'm gonna just do that little interview. And I'm gonna, a lot of questions to ask, but I'm gonna jot down some things just so I can remember those things. Okay.
Okay.
All right. Um, do you have any medical issues
No.
besides your throat hurting? No blood pressure issues, diabetes, or anything like that? All
Mm.
right. Good. So I'm gonna put none there. All right, and let's talk about family. We're just going to do mom and dad and grandparents. So, does your mom have any health issues?
Just high blood pressure.
Mom, high blood pressure. All right, what about your dad?
He has problems. He has a history of seizures.
Seizures? Okay, all right. And on your mom's side, what about her parents? Do they have any health issues?
Um, her her dad or grandfather wasn't there, and the mom had issues. She had issues with high blood pressure, and she had a stroke when she passed at the age of 76.
Okay, so stroke at the age of 76 and she died. Okay, sorry to hear that. All right, and what about your dad's side?
My dad's mom just has high blood pressure, and my granddad, nothing that I know of.
No issue. Okay. All right. Good. All right. So we're gonna move along to personal and social history. Um, so are you single? Married?
Single.
Single. All right. Do you have any children?
Yes.
Okay. How many children do you have?
Just one.
One child. How old is that child?
One.
One. 1 year old. Wow, that's fun. All right. How do you sleep? You sleep pretty good? Get at least 8 hours of sleep at night?
Try to.
Okay, sleeping good. All right. And can you tell me like do you attend church? Or what's your religion?
I'm Christian, and I don't go to church at the moment.
Okay. So what do you do to help your faith?
Just pray and watch videos.
Okay. Prayer, videos. All right. Um, what's your occupation? What do you do for a living?
I'm not working at the moment.
Okay. All right. And so what about your finances? How do you provide for yourself?
Um, my DoorDash,
DoorDash?
that counts as a job, but
DoorDash. Okay, that's some money. It's coming in. Okay. Do you have issues with transportation or getting your medications or insurance?
no.
Okay. What about your living arrangements?
I stay with my mom.
Okay. All right. Do you go out? Do you hang out, go clubbing or anything like that? Okay. Do you smoke or drink?
No.
Okay. Any illicit drug use?
No.
Okay. Good. All right. Now I'm just go over review systems. I'm gonna just go from head to toe and just kind of ask you if you have any issues going on in those areas. Okay. So generally, how do you feel? Do you feel healthy? Do you feel like you're well? Do you feel like you're well? Are you in good health?
Yeah.
Okay. Any fever, chills, fatigue?
No.
No. Okay. What about your diet? Do you take any supplements or vitamins?
No.
All right. And what about eating? Do you cook a lot at home or do you
Tend to eat.
eat out a lot? Oh, okay. All right. What about your skin? Let's talk about your skin. Do you have any rashes, bumps, lesions, moles, or anything like that that have come up, discolorations in your skin or anything, issues like that? All right. What about your nails? Are your nails brittle or are they strong?
They're strong.
Okay. All right. What about your hair? Have you noticed any hair falling out, thinning, balding, or anything like that?
Mm.
All right. Good deal. All right. Let's go to your head, ears, eyes, and nose. Any headaches, dizziness? Okay. Any blurred vision, trouble seeing?
Mm.
All right. What about hearing? Any issues with hearing? Have you noticed any drainage from your ears?
Mm.
All right. What about your nose? Any drainage from your nose? And besides your sore throat, any other issues with your throat? Have you noticed any masses, lumps, or swollen lymph nodes or anything like that?
Not that I'm aware of.
Okay, all right, good. Let's talk about breathing. Any coughing?
No.
Okay. Any problems breathing? Shortness of breath? Dyspnea? Anything like that? All right. How many pillows do you sleep on at night usually?
Just one.
Just one? Okay, good. Um, any chest pain?
No.
Heart palpitations that you noticed?
No.
Okay. Any edema in your swelling in your legs, extremities, anything like that? All right. And any indigestion, heartburn, abdominal pain, hemorrhoids, or anything like that?
No.
All right. Have you noticed any joint pain or swelling of the joints and being hot to touch or any weakness?
No.
Okay. All right. What about the age you started your menstrual cycle? You remember what age it was?
I believe I was 14.
14?
Not sure.
Okay. All right. When was your last menstrual cycle?
The 15th of September.
Okay.
Last
All
month.
right. And do you have regular cycles?
Yes.
Okay. All right. Any vaginal discharge or itching?
No.
Lesions, frequency,
No.
going to the bathroom. All right. All right. What about your breast? Any pain or tenderness or lumps?
Nothing.
All right. Do you do self-breast exams?
No.
Okay. That might be a good thing for you to do. What I tell most of my patients is to choose the day that you were born of that month, and then just do that every month on that day, and that should help you remember to do those because those are important. Have you ever had a mammogram or mammograms? All right. Well, at your age, I don't think you need to start until you turn 35. Okay. All right. What about any color changes in your extremities, ulcerations or discolorations in your legs?
No.
All right. Um, do you find yourself bleeding easy in your gums, cuts that don't heal, or anything like that?
No.
All right. And have you noticed any heat or cold intolerance, like not being able to stand the cold or heat? Okay. Have you found yourself like drinking a bunch of water and getting real thirsty and having to go pee a lot?
No.
All right. And any fainting, weakness, dizzy spells, something of that nature? Okay, no. All right. And any mood changes?
No.
Constant difficulty concentrating?
No.
And do you have thoughts of harming yourself or anyone else?
No.
Okay. All right. Give me just a second. Let me go back over and think. Are you on birth control?
No.
Okay. Going back to your history. When was your last pap smear?
Last year in January.
January. All right. Do you do regular dental exams? Do you go get your teeth cleaned?
Yes.
Okay. When was your last dental cleaning?
In August, the 25th of August.
Okay, August of this year. All right. What about vision exams?
Um, the last time I went was,
A year or two ago? 3 years ago?
I'll say a year.
A year ago? All right. And what about your immunizations, like the childhood immunizations? Have you had all those that you
Yes.
know of? Okay, immunizations are up to date. What about flu and COVID? Do you take those?
No.
You don't? Okay. No flu, COVID vaccines. Okay, okay. All right. I think that completes our little interview of your health history. Now I'm going to proceed to do your head to toe examination. With this examination, I'm going to ask you to change positions and turn and do some things. And if anytime you feel uncomfortable or you get cold or you get too hot or you just can't do it, will you let me know so we can stop? Maybe I'm going to move this chair out of the way. All right. So first I'm going to start with your arms. I'm going to feel your arms. No deformities noted, well built. Looking at your hands, hands are warm and dry. Um, Turgor's good. Nail beds are pink. Capillary refill is less than 3 seconds. I'm going to check your pulses. Bilateral pulses are 2 plus. Check your brachial pulses. Just relax your chin. Brachial pulses are 2 plus. While I'm here, I'm going to just check your epitrochlear nodes. I should not be able to feel them. I don't feel any there. And here, epitrochlear nodes are negative. And I'm also checking your nodes on your axillary, okay, in your arms. And I don't feel any there. All right, good. Now I'm just going to try some range of motion on your hands and arms. If you just do what I do, all right, in and out, and arms, up and down, shoulders, all right, and straight out for me. Back around. Okay. All right. Now I'm gonna check some strength. All right. If you squeeze my hands, strength is positive bilaterally. All right, and I'll just push against my hands there. All right, and pull. All right, and I want you to put your arms up and resist movements. All right, and pull back. All right, and on the shoulders. Don't let me push it down. All right, don't let me push it up. All right, good deal. Everything's intact. No weakness noted. Skin's warm and dry and intact, and no deformities noted in her upper extremities. Now we're gonna move on to your head. I'm looking at your head. It looks normal, cephalic. No deformities noted. I don't feel any masses or bumps in your head. Face is normal, cephalic. Everything's symmetrical and intact. All right. Now we're gonna go to your eyes. I meant to miss this step, wash your hands prior to. So we're gonna wash your hands. Apologize for that. All right, now put some gloves on, and then we're gonna inspect your eye. Now looking at your eyes are normal. Conjunctiva is pink, sclera is white, and pupils are round. And let's take this light, and I just want you to look straight ahead for me, okay? And there is a pinpoint light noted in both pupils. All right. And if you can look straight behind me at the wall there, I'm gonna shine this light in your eyes. And if it gets uncomfortable, let me know, okay? All right. Eyes or pupils are equal, round, and reactive to light. All right. I want you to follow this pin light for me, okay? Without moving your head, just use your eyes, okay?
Okay.
Nystagmus noted on the opposite side, which is normal, and her cranial nerve is intact. Alright. Now we're just going to inspect the structures of your eyes. Hair is distributed evenly. No exudate noted. Eyelash hair is distributed evenly, which is good. All right. I'm going to take this little apparatus here and we're going to look in your eyes, okay? The light might be a little bright, but if it gets too uncomfortable, just let me know, okay? Okay. All right. Looking at this eye, red reflex is noted. Looking at this eye, red reflex is noted. All right. So red reflex is noted in both eyes. Retina was visualized. Vessels were visualized. They did not look swollen or appear swollen. And the optic disc was visualized. All right. So now we've done your eyes. We're going to go to your ears. So I'm going to just inspect your ears. All right. Notice that there are some piercings. Looks like 3 or 4 piercings in this ear. I'll palpate your ear. No bumps or lumps noted. Come to this side. Inspect your ears. It looks like there are 3 or 4 piercings noticed in this ear as well. No bumps or lumps in this ear. So I'm gonna step back and I'm gonna just say one little word. I'm gonna whisper it, and I want you to repeat what you hear. Okay?
Okay. Train.
Okay. I'm gonna do this on the opposite side. Bus. All right. Good deal. All right. Now I'm gonna kind of look in your ears and then look at your eardrum there and the structure in your ear. Let me know if this gets uncomfortable. All right. Eardrum visualize its pearly gray structure. Bony structures are visualized and intact. All right. Eardrum visualized. Pearly white or gray. Bony structures noted. Um, eardrums intact. All right. Now we'll do this Weber and line test. So I'm gonna take this apparatus. I'm just gonna kind of hit it a little bit. I'll place it on top of your head. And I want you to let me know if you hear it more in one ear or in another, okay? So,
In both ears.
all right, good. All right, so next I'm gonna do what they call a line test. I'm gonna get this tuning fork and I'm gonna put it on the back of your ear on the mastoid bone. And I want you to let me know when you stop hearing it. When that stops, I'm gonna move it around to your ear and I want you to let me know when you stop hearing it around on your ear. I'm gonna do that on both sides, okay?
Okay.
All right, ready? Here we go.
Stop hearing.
Okay.
Stop hearing.
Okay, good job. All right, I'm gonna do this on the other side. So, good job. So, bone conduction and versus air conduction. Bone conduction is shorter than air conduction, so those times were congruent with that. All right. Next, we're gonna go to your nose. Nose on. We're gonna inspect your nose. Is midline symmetrical and intact? No lumps or bumps. Is that tender anywhere? No, right? All right, and we're gonna look inside. I'll just bring back on just a little bit. All right. Turbinates are visualized, pink and moist. Nasal septum is midline. Intact. All right. Now we're gonna go to your mouth. Lips are symmetrical. They are pink. Are within normal limits for this ethnicity. I'm gonna take one way. Just gonna look inside your mouth here. Just open wide for me. Stick your tongue out. Oh, and turn around. All right, stick your tongue out. All right. You notice that her teeth are just about all of her teeth. All right. And I noticed that her tongue is resting on the bottom of on the floor of her mouth well. All right. Can you stick out your tongue and say ah? All right. Uvula is moving when she says ah. One more time. Not ah, just open your mouth. Tonsils are not swollen, but they are visualized. All right. In this part, I'm gonna have to fill around in your mouth a little bit, okay? Buccal mucosa is pink. Just no bumps. Is that tender anywhere? Noted. Teeth are not loose. Alright. All right, now I'm gonna move to your neck. Okay. Neck is within normal limits or color for ethnicity. You're just gonna feel no lumps or pulsations noted. All right. Now I'm just gonna feel for some nodes, okay? Preauricular nodes, post-auricular nodes, tonsillary, submandibular, segmental, cervical, just trying to make that one, deep cervical, right? And supraclavicular, if you noted, right? And occipital. Okay. All right. So now what I want you to do is to push against my chin. All right. If you stick your tongue to the inside of your and push against my hand. There we go. All right. Good job. All right. So we've done the neck. Now we're gonna go to your chest. I'm gonna start with the back of your chest first, okay? All right. Standing at the back of the chest, if you could just turn slightly for me. Thank you. Standing at the back of the chest, take some deep breaths for me. I note symmetry with deep breathing. All right. And then palpate for symmetry, deep breath for me. All right. Now I'm going to place my hands on a few places on your back, and I want you to say 99 every time I move my hands, okay? All right, here we go. 99. Okay. All right. 99. All right. 99. Good job. All right. Now I'm going to percuss your lung fields. And resonance throughout. Then I'm gonna listen or auscultate lung sounds and just take a little bit deep breath than normal, not too big. I don't want you to faint, but if you get to feeling faint or dizzy, just let me know. We can stop, okay? All right, here we go. All right, no evidences for the sounds noted. Okay, I'm gonna check under here a little, okay? You can relax your arm in front. All right, deep breath for me. This side, third one. No evidences for the sounds noted there. I'm also gonna go through and listen, and I want you to say Eve every time I'm in my stethoscope, okay? And I'm just checking for goth. Eve. Mm, 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 All right, good. All right, the dolphin you know it throughout. All right, now we're gonna go. I'm gonna check for CVA tenderness. So I'm gonna just kind of put my hand on your side of your chest and pound a little bit. It shouldn't hurt, but if it does, let me know. Okay? Any pain there? All right. All right. So I'm gonna turn it to the front. So I'm looking at her chest, and respirations are even and unlabored, and breathing is symmetrical. All right. So I'm gonna listen to my sounds here. Okay. Tisha's breath sounds noted. Um, I'm gonna check one more thing on your face that I just remembered that I forgot to do. So I'm gonna listen to your arteries, your temporal arteries, okay? Make sure there are no bruise. And no bruise noted on the temporal arteries. All right. I'm just gonna palpate and feel if there's any lumps or any tenderness here. All right. Not anything. All right, good job. So now I'm gonna check your heart and get you to lay back on this pillow. Let me just the pillow real quick. All right, you get it. I'm gonna standing to the side of the patient. I'm gonna look for any heaves or palpations. I'm gonna feel any heaves. Breathing are normal. No heaves or palpations noted. All right, now I'm gonna locate the maximum point of impulse. It should be mid-clavicular, hip intercostal space. Maximum impulse is there. And I'm gonna listen and count for 1 minute for her pulse. Again, that's gonna be 1 minute. And count her pulse, and her pulse is 71. All right. Now I'm gonna listen to your heart sounds, and I'm just gonna put the stethoscope in different kind of places. Are you comfortable? Yeah. Okay. All right. So aortic, second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Tricuspid, uh, Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And mitral is mid-clavicular line, fifth intercostal space, left sternal border. All right, good. Now I'm gonna listen again in those same places with the bell of my stethoscope just to make sure I don't hear any murmurs. Again, that's the aortic, which is the second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And mitral, fifth intercostal space, midclavicular line, left sternal border. All right. No murmurs noted. All right. Now we're going to move on to the abdomen. Pull your shirt up a little bit, okay? Okay. And expose your belly. All right. So Looking at the tummy, contours, obese, skin's intact, no pulsations noted around the umbilicus. All right, could you raise your head up? All right, is that painful to you anywhere?
No.
Okay, no hernia noted and it's not painful to the patient. All right, so um, next we're going to auscultate vowel sounds in all four quadrants. Okay, vowel sounds are present in all four quadrants. Oh, while I'm here, I'm gonna go ahead and listen to your vasculature. You know, listen to the aortic, right, and the renal. Here, I'm just gonna go ahead and listen to femoral arteries. Right, and pulses noted in all quadrants and in the vascular. All right, so I'm just gonna do some light palpation on your tummy. Just let me know if it hurts. I'm feeling for masses, okay? Any tenderness or pain there?
No.
Okay, so I'm gonna do it again, but it's gonna be a little bit deeper and um a little bit stronger. So it might be a little painful, but if it is, if you let me know, then I'll stop. Okay. Um, again, I'm just feeling for masses or any abnormalities. Okay, no masses noted. No pain noted. All right, feel for femoral pulse here. Femoral pulses are too close. And while I'm here, I'm just going to feel and see if you have any lymph nodes that are popping up in here, okay? All right, no lymph nodes noted. All right. Next, what I want you to do, I'm going to get you to scoot back in the bed a little bit. I don't have a bed to pull out your legs, so get you to sit back just a little bit so that your legs are shady. All right, there we go. All right, so looking at our legs, legs are normal. They're straight and even, well built. Hair distribution is even, no skin issues, sores, varicosities. Testing for edema over the tibial, no edema noted. Dorsal patellis pulses are +2, and tibial pulses are +2 bilaterally. Looking at her nails, they are pink, no sores or anything noted. And capillary refill is less than 3 seconds. If I would have noticed any lesions, I would note the size, color distribution, measure in centimeters, and document any exudate, color, or order if there were any. All right. Now we're going to go to some range of motion exercises are for your hips and legs. So if you will, just lift one leg up and out to the side plane. Okay, you can put that back. All right, and then do your left leg, same thing. The side. All right, good. All right, can you bend this knee up for me? All right, good. Can you do the other knee for me? Okay. Any pain noted in with that range? Was any of that hard for you to do?
No.
Okay. If you would put your right heel over your left knee for me. All right. This position right here. All right. And I want you to resist my hand here. Push down. All right. And resist up. All right. Good deal. Now, if you would take your heel and move it all the way down your shin to your good job. All right. Gonna do the other side. If you put your left heel over your right knee, great. All right. And resist. Job. Resist. Job. All right. And if you would roll your left knee down your heel. All right. Good. All right. Now I'm going to test for any reflexes in your knees and legs. Okay. And on this side. All right. If you bend your knee for me, please. This is a um, anterior and posterior drawer that I'm checking just to make sure that your Achilles tendon is intact. Any pain with that? It's intact and no movement. All right. And I'm gonna make your knee up here. All right. And Applebee's and McMurray's. All right. And it's intact there. All right. Same over here. That pony. And we're gonna do the anterior and posterior drawer. No movement noted. All right. And selections. All right. And Applebee's. All right. Any pain with that? No. All right. You do latches here. All right. All right. Everything's intact. No joint movement noted. Let me check your reflexes. Babinski reflex. I'm gonna just rub this on the bottom of your feet. It shouldn't hurt. Might be a little ticklish, but okay. Positive Babinski's and bilateral feet. All right. If you would just relax your leg here, I'm gonna just test for your Achilles. Okay. See here. Relax your leg for me. All right. Now I'm gonna get you to sit up. And all right. Now what I want you to do is just walk for me. If you would walk all the way to that window and back. All right. And walk back heel to toe for me. Heel to toe. Good job. All right. And if you walk back toward the window on your tiptoes. All right. And if you walk back on your heels for me. All right. Good job. Now I just want you to stand right here for me. No swaying noted. All right. Close your eyes. And Romberg says is negative. No swaying noted. All right. Now what I want you to do is stand right here. And I'm just going to take a look at your spine. Spine curvature seems to be intact. No lordosis or kyphosis noted. If you would bend over for me. There we go. All right. Spine seems to be straight. Gluteal folds are in alignment. All right. You can stand up for me. And it looks like her scapula. Hold your arm up. Shrug your shoulders up and down. All right. And it looks like her scapula is intact as well. I can put your arms in. If you will hop back up here on that bed for me. Give me a moment to make sure that I've done everything that I need to do. Um, um, I did not assess long-term or short-term memory. Do you know who the president is now?
Joe Biden.
Okay. Do you remember who the president is before Joe Biden?
Donald Trump.
And the president before that?
Barack Obama.
Okay. All right. So that is testing for long-term memory. Short-term memory at the beginning, I would have given her 3 words to remember, and then I would have asked her at the end of my assessment what those 3 words were. However, I failed to do that. Let me think a moment. If there's anything else. I think that's it. Okay, well, I thank you so much for coming out and letting us assess you. We'll get some throat cultures and make sure you don't have strep throat or mono or anything like that. And after those test results come back, we'll figure out what we'll do after that. However, the tea that you're taking seems to be doing okay. If you would like to, you can add ibuprofen or Tylenol to help with the pain, help relieve some of your pain as well. And the cold and hot, that sounds good as well. Okay. Thank
Okay.
you so much.
Thank you.
All right.